So founded in 2009, Medical Marijuana 411 is one of the first and most trusted online resources for medical cannabis education. Our community, their community, of physicians, patients, and researchers are committed to providing the very best online education platform based on peer review research for those seeking education that is research-based and unbiased. Dr. Jake Felice will be the keynote speaker, and he's on the advisory board for Medical Marijuana 411. He's going to cover the basics of the endocannabinoid system, which is the largest receptor system in the human body, how cannabis works with our own ECS framework, the pros and cons of how to medicate, why cannabis is not taught in medical school, pain management, sleep and anxiety, and then we can always do a Q&A if we have time, and feel free to post questions in the comment section for him.
Thank you so much for that introduction, Laura. Give me a moment here to share my screen and make sure that everything is looking good. We're going to learn some things in the presentation today that I think are applicable not only for seniors, but for all of us, because a large part of this endocannabinoid system, I'll say the word ECS, a large part of it is about maintaining and preserving stress of all types in the body. And one of the ways that the endocannabinoid system, or ECS, does this is through improving biologic communication between our cells, our organs, and our body system. So this system that cannabis runs on, our body uses to manage an immense amount of biologic information. I think of it as a lot like the internet of our body. It's more like a fiber optic network, but the word internet, I think, is applicable. If an immune cell, for example, needs to communicate with a nerve cell or vice versa, they can do that through the endocannabinoid system. All biologic systems are wired for connection and communication. We are now, as humans, connecting and communicating through this online system, and we're doing it through the internet. If our internet speed is bad, my video quality can go out, my sound quality can go out, but if it's good, we have good, adequate connection. So we'll use this idea of internet speed and connectivity to kind of look at this biologic system and how there are a lot of similarities between them. You'll also hear a word that I encourage you to Google. It's called homeostasis. Homeostasis is the dynamic equilibrium that living organisms have that keeps us from being, keeps us alive, keeps us from being dead. A dead organism is the same temperature as the environment. As living creatures, we maintain our own temperature. That's an example of homeostasis. So homeostasis is biology keeping itself intact despite a wildly or frequently changing external environment. So the ability of our physical organism, of our body, to keep ourselves healthy implies the existence of systems that help us maintain the normal state, our normal state of health. And the ECS is very much involved in this. And biology is able to maintain this inner equilibrium because it's capable of modifying itself. We're capable of changing how our immune cells work. We're capable of changing how tissues and organs react on a physiologic level. One of the advantages of having a body, which is kind of an abstract concept, but if you think biologically, we came from single-celled organisms 600 million years ago in the ocean to large creatures that have a body and and go to Shakespeare plays and watch Teenage Mutant Ninja Turtles. Biology has come a long way from single-celled organisms 600 million years ago, but each and every one of our cells in our body requires the nutrition that was necessary from an evolutionary perspective a long time ago. Really, a large part of what I'm about is education. I do have a clinical background and have seen hundreds and hundreds of patients for cannabis therapeutically and clinically. But I come to you today as an educator, and plants have a lot of similarities to pharmaceutical medications, but they also have a lot of differences. With the cannabis plant, there are hundreds and hundreds of potentially beneficial therapeutic molecules. With a typical conventional pharmaceutical drug, it's one single chemical typically. So that makes plants a lot more fuzzy to study in a lot of the ways. It doesn't mean we throw science out, but what it does mean is that the scientific aspects can be a little bit more subtle, and that's why education is important. And I'd like to make a shout out to the oral tradition, which is one of the best ways to learn about botanicals, is not from reading a book, but from having a conversation with somebody. I believe that if as humans we aim to maintain our health, we will need to care for our endocannabinoid system. It is the largest receptor system in the human body, which means it is governing a massive amount of biologic information in real time in any given second. And for me, what this whole system is about communication on multiple levels: communication between cells, communication between tissues, between organs, and organ systems. I think that as 21st century biology progresses, this system is going to become more and more important because it is so large and it is so involved in so many different things, physiologically speaking. What I'd like for you to get from this course are not necessarily specifics, but that we all can utilize this system to preserve and maintain our health. You'll see that it is influenced not just by cannabis. Cannabis is just our teacher in a way, because we have used cannabis and the molecular tagging to understand this system. If it weren't for cannabis, we would have no idea that it even existed. So in many ways, this plant is our teacher, teaching us about the scientific aspect of it. And that by maintaining our body's own internal communication system, this endocannabinoid system, we can influence our physiology for the positive. So that's one of the main things I'd like for you to get out of this. So what are cannabinoids versus endocannabinoids? The word endo means inside. So an endocannabinoid is a molecule that our own body naturally makes to work on this ECS system. You've probably heard of endorphins. When you run and you get a runner's high, they call that an endorphin. That endo prefix is the same thing, but that's runs on our body's morphine system. So the endocannabinoid is our body's own natural cannabinoid system. It just so happens, coincidentally, that plant molecules will land on these receptors and affect them in similar ways that our body uses to maintain biologic communication. So cannabinoids are the naturally occurring molecules found in the flowers of cannabis. They work with the ECS, which is composed of receptors, which we'll talk about in a little bit throughout our body. And that helps control many of our body's functions. And cannabinoids support the endocannabinoid system and aids all systems in the body to work together for the promotion of health and homeostasis. This plant has been around with us for a long, long time. Depending on who you talk to, thousands and thousands of years at a minimum, scientifically speaking. And I hear a lot in the literature, and I think this is something that 411 is a very good proponent of. I hear a lot of folks saying we need more studies, and absolutely agree, we always need more studies. There are an immense number of peer-reviewed scientific studies on cannabis, hemp, and the endocannabinoid system. In fact, more than 25,000 articles since 1995 in peer-reviewed journals have been published on this plant and this communication system. So it's very old, and the amount of scientific literature is very deep, and at the same time we are getting more and more research being published every day, and it's very exciting. As I said, cannabis is nothing new. We have, at the turn of the 20th century, over 100 years ago, cannabis products were in drugstores throughout the United States, and millions of prescriptions were written by doctors every year for cannabis. Some of the main things that things were written for back then were sleep, anxiety, and pain. Pain is something that cannabis does a pretty good job with. It is a mild pain reliever, so it is not a super strong pain reliever, but I do believe that it can be considered putatively effective, which means that it's generally accepted that it is true that it relieves pain. Why is a mild pain reliever good or sometimes better than a stronger one? Well, with cannabis products, the amount of toxicity is extremely low. And study after study is now showing that when patients or individuals use cannabis, and that can be hemp and CBD products, it does not have to get the patient high, but when they use cannabis products, they tend to use less of their more toxic medications, such as opiates or even NSAIDs, which is, I think, most frequently a good thing. So just to tie things in, we're going to be talking a lot about cell communication and cell receptors today. So I want to make sure that everybody has a good idea of what a cell receptor is. A cell receptor is something that receives, it reaches up and it takes information from outside of the cell, brings that information, pack it in, kind of like an email, to the inside of the cell, and then physiologic changes can occur. If you look at this photo, you'll see a cross-section of a blood vessel with some cartoon immune cells, and they are sounding the alarm by letting other cells outside of the blood system know that something is going on, and they send these little molecular packets out, which that are then received with those catcher mitts type of a thing. So think of a cell receptor as a big catcher's mitt that just simply catches a molecule, brings it inside the cell, and that tells the cell what to do through its biologic programming. The endocannabinoid system is a homeostatic system. This comes from the journal Neuroimmunomodulation. It's titled Endocannabinoid System Participates in Neuroendocrine Control of Homeostasis. Whenever there is a change in the body, the endocannabinoid receptors, those catcher's mitt, will shift. So that if there is a pain event or if there is any kind of a health disrupting event, the body instantaneously responds by shifting the numbers of catcher's mitts and allowing for more biologic information to occur. This happens nearly instantaneously, so it is a live system. And this instantaneous production underscores the ECS role in the body's rapid response to its environment. Part of what this system does is it helps us respond to changes in our environment. Cannabinoid receptors are located throughout the nervous system. They regulate pain perception. They will also regulate inflammation, etc. But part of what they are doing is affecting the perception of pain. I mentioned that it's a rapid response system. If we look at inflammatory studies, and you'll see all of the peer-reviewed studies are notated on your screen. You can take screenshots if you want to grab those, or feel free to email me. These receptors within tissues are nearly instantaneous and underscore this rapidity. So CBD improves clinical models of rheumatoid arthritis. So this is an animal study. But what's really exciting is it's not only working with an anti-inflammatory effect, but it's altering cell signaling. So it's altering how cells are literally talking with each other. And when they do this, it prevents the destruction of cartilage and breakdown, again, in non-human studies. But what we are seeing is that there is a biologic communication that is being improved with this system when we add cannabinoids to the mix. Also, in terms of pain, elevated levels of the receptor, the catcher's mitt, like the opioid, are found in areas of the brain that modulate pain processing. So in our centers of our brain, where the computations are occurring for how painful is my elbow today, those areas of the brain have very high levels of these cannabinoid receptors. So again, these receptors are fluctuating with pain levels. In osteoarthritis, we talked about rheumatoid before. Again, in an animal study, cannabinoids provide relief in rats by triggering the release of endocannabinoids. So the earlier studies, we looked at cannabinoids coming from outside of the body, from plants. This study is showing that when we increase our body's own natural endocannabinoid levels, it's also providing relief in animals with osteoarthritis, and other studies are also showing relief of muscle spasms, and this in human studies associated with multiple sclerosis, and then can also mitigate pain in fibromyalgia, again, human studies. It's much better, obviously, to have a human study than an animal study, but the animal studies can certainly show us a lot. So what is the end result of all of these new CBD products, all of the hemp, cannabis, and THC products? Well, here we have a graph that is showing opiate deaths in the state of Colorado from the year 2000 moving forward. As the years progress, more and more Americans have been dying of opiate-related overdose deaths. It's a tragedy. It's kind of left the news cycle lately, but it is still going on. We see a very remarkable thing in 2014. You'll see on the graph that curve is instantaneously starts to flatten. And that correlates to the onset of new medical cannabis laws in the state of Colorado. The state of Colorado is not the only state that has done this, and in every state where we see an onset of new laws, we see a decrease in the curve of the opiate-related deaths. I'd be happy to take questions about that. It's a very interesting topic. So CBD products may be, and cannabis products may be enhancing consumer health. This comes from the American Journal of Public Health, and the investigators said, hey, look, legal cannabis in Colorado, we're seeing these changes, let's replicate this. And as we have seen new data coming out, we are seeing similar patterns happening over and over again. Also on the pain relief side, this is how I know that my patients are getting their dosing close to being right. This study is from the journal Pain Medicine, a peer-reviewed study called Restored Self, a phenomenologic study of pain relief by cannabis. And what it's saying basically is that when you get the dose right, patients start to feel like themselves again, restored self. So they'll say things like, I finally feel like myself again, or I lost my mojo, but I've got my mojo back. Or I lost my shine, I feel like I'm getting my shine back. These are, and the authors state, we propose the term restored self to conceptualize the effect of medical cannabis. What a lot of folks say is, I'm back. And that's a beautiful thing to see in the clinic. So how is this all working on not only just pain, but for so many different things? One of the ways is that this system supports a healthy stress response. And Lord knows we all have a lot of stress. And if you are one of the rare exceptions that don't, this may not apply to you, but it certainly applies to people you know. The ECS supports a healthy stress response, and we can define stress as a non-specific response of the body to any demand for change. So think of the speed of the internet here. Think of the speed of the internet here, and when the internet is slow, communication is inhibited. That's called an endocannabinoid tone. If it's at baseline, that's good. If it's enhanced, that's better. And if it's depressed, the communication isn't happening. So it's the improper adaptation to stress that can cause difficulty. So this is not necessarily about the actual stress, because we're all going to have stress, but the adaptation to stress. Especially as we age, adaptability is a critical human skill. And we are finding that we can actually help our adaptability, not necessarily by working on our external problems, our to-do lists, etc., which is good, but we can also support our physiology. And by supporting our physiology, that can help with the adaptive process. In classical physiology, the effects of stress are mitigated by something called the HPA axis. I will call that the adrenal axis sometimes. That's what the A stands for, but HPA stands for hypothalamic pituitary adrenal axis. And it is how the brain communicates with the endocrine organs, the glands, the adrenal glands. And so you'll hear me say either stress axis or adrenal axis in the next few slides. So this endocannabinoid signaling is a driving force for maintaining this adrenal axis function. If we block our endocannabinoid system, we immediately see higher levels of stress hormones. So you take out the communication network, and all of a sudden people can't talk to each other, or cells aren't communicating as well. It causes an increase in stress hormones. Likely a healthy functioning endocannabinoid system will limit or lower the cortisol or the stress hormone functions. So a supported ECS, a supported endocannabinoid system reduces stress activity, but when it is blocked, that increases the stress. And one of the ways that stress increases is when it becomes chronic, because chronic stress actually will lead to disruption of the communication system. It's kind of like if there's an emergency event, everybody gets on their cell phone and the network gets clogged up. If the stress is happening day in and day out and the weeks turn to months, that puts stress on the communication system in the body. One of the things that is happening is that the cannabinoids help balance the system that keeps us balanced. So for example, CBD products will actually increase endocannabinoid tone, so that when we give CBD, it increases our body's own natural endocannabinoid levels. CBD also prevents overstimulation. If this were a live classroom, I would ask you how come that might be and when might that be appropriate? When can this system be overstimulated? Well, it can be overstimulated if you have too much THC. A lot of people don't like that. So for patients or just individuals, whomever is listening, the use of CBD along with THC prevents or can help mitigate the sensation of having too much THC or getting too high from the THC. Typically, I find, clinically speaking, THC can be helpful, but it's most helpful for most people in very low doses. And one of the big problems that many patients will have when trying cannabis for the first time is that they take too much of it and then they don't like it and they don't want to try it again. So one of the ways that CBD can balance this system is it prevents overstimulation of the receptors by THC. We know that self-reported stress ratings directly correlate with your own endocannabinoid system. So if we ask you, take a snapshot and say, how are you doing right now? Oh, I'm having a pretty good day today. This is unusual for me, but I woke up and I'm having a good day. Self-reported stress ratings directly correlate with the endocannabinoid levels and the communication in our body's endocannabinoid system, which really indicate and point towards a balancing role for this system during stressful events. I love this slide. I call it the wheel of synergy. One of the reasons that cannabinoid products tend to stabilize physiology as opposed to really move it hard like a single molecule drug is because it's hitting so many different pathways at the same time. And that creates a supportive biochemical network. When you hit one pathway hard, especially with a chemical that is very powerful in moving physiology, is you can have toxicities. So one of the rationales and benefits of plant medicine is typically plant medicine, not always, but typically possess very low toxicity. And one of the reasons is that plants contain tens, dozens, and in the case of cannabis, hundreds of different molecules that can affect different pathways. The thing to Google if you are a science person is network biology. You have a reference here if you'd like to dig deeper. But network biology involves the study of complex interactions of biomolecules and pathways. You'll see at the top, CBD is hitting so many different pathways, whether it be pathways for anxiety, pathways that have anti-epileptic effects, neuroprotective effects, helping with blood or with muscle spasm effects, so many things, this plant is hitting so many different biologic targets. That's what I mean by it's fuzzy to study. You can study one pathway very precisely, but when you start adding more pathways, things become complex. We're now using artificial intelligence, and computers will be like the microscope of the future because we are going to be able to analyze these interactions in artificial intelligence environments. And this is proving very exciting for research. Let me check my notes and see what else. This is hitting a communication network, and one of the things that is important is the network needs to remain robust or we have problems. And because if the communication network breaks down, there's problems. So if the disease alters the balance of our physiology, the recovery of that equilibrium is a promising venue for research. And remember, as human beings, our physiology is an open system. I'm having tea right now, breakfast this morning. All of us we're breathing. We are bringing molecules in at any given time to our body and out. And so we are open systems. So changes in our environment really affect us. These are some of the highlighted mechanisms of CBD. We don't have time to talk about others, but I can in the Q&A. CBD helps balance our ECS, by increasing the body's own endocannabinoid molecules. It helps with anxiety, pain, and sleep through actions on serotonin receptors. That's not the only way it affects pain. It can decrease pain and inflammation through something called TRPV1 receptors, TRPV1. The V stands for vanilla. We discovered this molecule when looking at how does vanilla help with headache, and we found this receptor system. Vanilla goes well with cannabis, and for headache and migraine, a lot of the times they can be blended. Again, we'll talk about that with plant synergy. Anti-anxiety and improved cardiac function through a different receptor family. Increased bone density. Helping with things like osteopenia, osteoporosis, and decreased cancer proliferation through a different receptor family. And one of my favorites, neuroprotection via antioxidant and something called glutamate toxicity, which we'll talk a little bit about, but good neuroprotective properties. So instead of hitting any one pathway hard, this plant is hitting dozens and dozens of pathways softly. We get low toxicity, and instead of getting very specific results, we get these broader acting results, which are a little bit more difficult to study unless you really understand why this is all happening. And one of the reasons is because it is enhancing communication networks in the body. There's a lot of evidence for potential health benefits. That's not what this is about, but all of our courses at 911 go back to the peer-reviewed literature. You can see some of that here on this slide. And here are a list of partial health conditions. These conditions are ones where there is a high degree of evidence. If it is in green, that's a higher degree of evidence, and the highest degree of evidence are the ones that are bolded in green. Many times, and I think there's a lot of evidence supporting the use of cannabis in migraine headache, for example, or MS, for example, or nausea, for example. But it doesn't always work, because nothing always works. No medication always works. But if a patient has a migraine headache, I usually am hopeful that it's going to help with their migraine headache. It may not, but they may have a sleep issue that it benefits, or they may have an anxiety issue that it benefits. So that when a patient takes a cannabis or a hemp or a CBD product for any particular health issue that they may have, it may or may not affect that, but chances are it can also help upregulate or preserve health in other areas. This system is all about balance and communication. We've already seen this slide. So this system consists of our body's own endocannabinoid molecules, the receptors, which are the catcher's mitts. I mentioned that it is the most dense receptor system, and it maintains the flow and balance of all of our organs, regulates our blood sugar, our immune function, muscle and fat tissues, hormones, pain centers. And the reason it does all of this is because it is a networked communication system, which we're going to look at here in a little bit. Self-regulating, it's a live system, so it is changing on the dime instantaneously. If I'm skateboarding and I fall down and I sprain my wrist, the response is instantaneous with the receptors in my brain, the immune and inflammatory receptors in the hand and in the wrist.
Dr. Jake, the first question I have is from Helen, and she asks, what does research say about effects of cannabis with a patient with Parkinson's disease?
So Parkinson's is really tough. I have had a lot of remarkable failures with Parkinson's disease, and it's something that's very close to me because my grandmother had Parkinson's disease for many years before she passed. In terms of the neurodegenerative component, there are a lot of studies that show that Parkinson's there aren't studies on Parkinson's per se, but that cannabinoid products help preserve aspects of the nervous system. You'll see online a lot of pretty miraculous looking videos of people with Parkinson tremor having that tremor pretty instantaneously be reduced with cannabinoids. My experience is that that is not the majority of patients, rather a lucky few. Parkinson's comes with other issues. Depression is one of them. Cannabis may or may not be helpful for that patient. If their physiology is adaptable to THC, that may help. But many people's physiology is not adaptable to THC. So especially if they're on an antidepressant medication, that could cause issues. So talking specifically about antidepressants and cannabis use with THC of any high level, I recommend talking to a clinician who's well versed in that. They used to be rare. A lot of doctors are now much more up to speed on these types of interactions. But patients with any type of neurodegenerative disease that is progressive will suffer both physically and mentally, because some days you have good days and you're back, and other days you have bad days and you're down. So I think that even if the cannabinoid product, whether it be a hemp CBD oriented product, even if it is not necessarily helping with what the patient is wanting it to help with, that's obviously a very important thing, but there may be other residual benefits such as improved sleep, or wow, I just really relax after dinner after having CBD, and it just helps me not worry so much. So in terms of actually affecting the disease process of Parkinson's, that's difficult, and it's difficult because it's a difficult disease. But that doesn't mean it can't be helpful. It just may be helpful in ways that are not expected, and a good expert or clinician can keep an eye out for that and say, oh yes, I'm sorry, it may or may not be working for this, but look at these other areas that it helps with. Thank you.
Okay, thank you. Second question is there a formula for elders wanting to take edibles?
Yes and no. So the yes part, please do not take too much THC in an edible if you are any age. I would suggest starting with very low doses is the general way to do that, and go slowly. One of the most common things that happens with edibles is that people will take some and they'll wait an hour, hour and a half and not have any results. And then they'll take more, and that more is the big mistake. So you need to start low and go slow with your dosing. We know that the drug interactions are very rare, especially with CBD products when it's at less than 75 milligrams per day. But to check on those, you will need to refer to a doctor who's able to prescribe those medications. But in general, most patients tolerate it very well. I would suggest that if you are a newbie or a new person or a very not experienced person, one place to start are with cannabis topicals. Topicals do not cause a head high, even if they have THC in them, and are mildly effective for pain. So if there's a sore knee, you can put it on the knee. They're so subtle. Topicals are so subtle, that's why they're good, is that they're likely not going to create a bad experience. It almost never happens. But what sometimes happens is it can benefit patients and they don't know it. And what do I mean by that? Let's say my knee pain is at a 6 out of 10. I put the topical on it and forget about it because it doesn't make me feel high. I can go about my day and my pain can drop from a 6 to a 4, and I just feel like I'm having a good day. I may not have noticed, our nervous system doesn't notice as much when the pain gets better, but it notices right away when it gets worse. So instructing either yourself or instructing a patient to give that pain a number before they put the topical on. It usually comes down by about 2 points. So there is no official guideline because cannabis is a non-regulated product and it's a plant. We don't have the studies set up to be very specific about specific dosing, but about general dosing, we have hard and fast rules, which is start low and go slow, especially with an edible, especially with THC. Look for other benefits. Those would include benefits for pain, anxiety, sleep, and other areas that the patient may not be expecting, but might be receiving and not know it. And also, if your topicals are a good way to introduce these products, and if the patient's not paying attention, it's actually easy for them to miss its benefits because the benefits are observable but subtle. So that's kind of a long answer to a short question, but a good question.
That's great. Thank you. Another one, Laura wanted to know, do you have maybe a list of potential side effects that are common in older adults when using cannabis?
A lot of the times, sleepiness is one of the most common side effects. Now, if you are taking cannabis in the daytime and don't want to be asleep, that can be a problem. But if you are at night and you want to be asleep, it can be an advantage. Also, depending on the dose, it is a plant-based product. So anytime we introduce things to the digestive system, it can cause some loose stools. That's somewhat common. I find it less common with, it's called MCT extract, which is a coconut oil extract that uses a gas versus an ethanol. I think that the alcohol-based oral products sometimes irritate that. And it's not because of the alcohol. I think it's because of the chlorophyll that some people's systems don't respond well to it. So that's also a very common one. We don't see many side effects at all from CBD. It tends to be generally well tolerated, but you do see a lot of side effects from THC. And almost all of the time, the vast majority of the time, that's from patients taking too much of an oral product. And just like a small percentage of the population use THC to get high and feel good, I would say probably more people at moderate doses of THC feel bad than they feel good. So keeping the THC dose low is absolutely critically important, especially with an edible. I just can't stress it enough. And the reason it's important is not because it's going to harm the patient, other than that they feel terrible, but that they just will have a terrible time and not ever want to use this medication that at the right dose could really possibly help them.
Okay. And the next question says, can you speak to the entourage effect and if you recommend using products that are full plant extract or have small doses?
I'm sliding my slides forward. Yes, entourage effect. Let's talk about that. The entourage effect sometimes is also called synergy, where the whole is greater than the sum of the parts. We know that studies show that the whole plant extracts are demonstrating 2 to 4 times greater effect than single molecules. You'll hear the word spectrum. It goes back to that wheel of synergy picture that I have here. If you're using a single molecule, such as a CBD isolate, that can have some effects, but you're missing the whole broad function of all of the other plant molecules. So let's talk about CBD and THC. THC all by itself as a single molecule, patients don't like it. It's called Marinol, M-A-R-I-N-O-L. There's a synthetic THC that's used to treat nausea and vomiting from chemotherapy. Patients don't like it because it's not mixed with another molecule. It's too harsh on the physiology. But when you add CBD to that THC, by just adding one extra molecule, you get a tremendous decrease in the amount of side effects, and you get an increase in the effectiveness. So having multiple plant molecules on board enables the product to work better at lower doses and have fewer side effects. And it comes from the synergy, or the whole being greater than the sum of its parts. I like to use the analogy of a metal alloy for synergy. And beginning of World War II, we had the ability to make jet engines. We had the mental, but steel would melt and it was too heavy, so we couldn't get an airplane to fly with just steel as a jet engine. But if you combine chromium with some nickel and a few other minerals, you get an alloy that is stronger and lighter. So an alloy is a good example of a few things in lower percentages combining together to make something stronger. We get the same thing with whole plant medicine. So look, I don't believe in the word full spectrum. Nobody's told me what that means. But if you see the word spectrum, broad spectrum, full spectrum, I don't like that term, but it's on a lot of marketing. I think that's generally a good thing.
All right, another question is regarding migraines. Has there been studies with migraines due to craniotomies as opposed to migraines without any surgery?
Not that I am aware of. I don't think the literature is that robust yet. We are still at the beginning of human clinical studies. I do, however, think there is a good body of evidence for cannabis in the assistance of migraine headache, but anything post-craniotomy or other type of surgery, I don't know that that has been elucidated. I think it's cannabis for migraine is always worth a try. Migraine is one of the few conditions where I sometimes recommend inhalation versus an oral product. And the reason for that is oral products can take 60, 90 minutes up to 2 hours to work. And if someone has a migraine or you get an aura and I know it's coming, taking an oral product's not going to give you enough time. So the inhalation is not smoke, but they make vaporized apparatuses. An acute onset of a migraine headache is one indication where a patient may want to consider an inhaled product because it works so much faster. So I wish I had more answers on the specifics of post-surgical effects versus not, but we just don't, there's not any studies that I'm aware of. So.
Okay, this is kind of a follow-up question someone had. Curious about the efficacy and efficiency of various delivery methods. You were talking about smoking, vaping, edibles, capsules.
Great. Good question.
Is vaping the same as inhalation? He wants to know.
Vaping is a type of inhalation. With vaping, there's no burning. You're basically heating the plant flowers to an amount that the cannabinoid molecules go into a vapor, but there's no smoke. So it does have some advantages to the lungs. Now, in terms of vaping versus edibles versus topicals, that's a very important distinction, which I think we should take a minute or two to talk about. Main advantage of inhalation is it's fast. That's why it may be appropriate for some migraine folks. It's very fast, and it's also very easy to keep a steady dose with an inhalation, meaning it's much easier to have too much with an edible versus with an inhalation. If you have too much, you literally just have to wait 15, 20, 30 minutes max, and you're back to yourself again, versus if you have too much of an edible, that can be hours and hours and hours before that goes away. Now, the downside of that quick acting is it's also quick to go away. So if you have an inhalation product that's quick to act, it's also going to be quick to go away, so that if you're using it to sleep, You may use an inhalation to get to sleep, but it's not going to keep you asleep for 8 hours because effect is going to go away fast. So for sleep, a lot of the times an oral product is better because it's slow onset but longer duration. And again, the downside of an edible is having too much of a THC product and you just have a bad experience with it. One of the advantages of topicals is that they work in conjunction with edibles or inhaled, so that if I have an injured wrist and I put it, and it's a 6 out of 10, I put the topical on my wrist, and then it's a 4 out of 10. I can then do an oral product that may help reduce it a little bit more. Again, topicals take about 20 minutes to work versus inhalation, which takes about a minute or two to work, versus an edible, which takes an hour or two to work. So there is no right or wrong. It is more about what is the appropriate for your situation, what is it appropriate for the patient's situation, and what are the pros and cons of each one. Because a pro of a quick act, one of the pros is it's quick acting, but one of the downsides is that it's not long acting. Long answer. Any follow-ups on that? That's an important one.
Well, I did have a question about this device I remember seeing a few years ago that was something of a small tent. And there was water bubbling.
Yes, I believe that's something called the volcano vaporizer. And basically, instead of putting in the tent, I'm thinking I'm describing the right thing, is it fills up with a vapor and then you can detach it and inhale it. Those are, I think, good products for many folks who want to inhale. One of the downsides of that product is it takes a little while to set up, but once it's set up, it's very effective. What I like about the larger heating elements in a product like that is it's really about the quality and control you have on your heating element and how sensitive and specific can you get the temperature. Because believe it or not, if you have it set at 260 degrees Fahrenheit versus 300 degrees Fahrenheit versus 325 degrees Fahrenheit, you're going to get a different response coming off of that. So the bigger products are better for that than the little small battery vapes, but not as portable, not as convenient. Was that kind of what you were talking about, Danny?
All right, and we have
Yes,
another
thank you.
question up here from Heather. She wants to know, scientifically speaking, why is it important to have small doses of THC alongside a dose of CBD? She often hears bud tenders and folks in the industry say THC activates CBD in the brain. Is this an accurate statement?
Unfortunately, it's not an entirely accurate statement. What CBD does is it mitigates the negative side effects of THC, so it prevents the system, it can help prevent you from getting too high, is one way to say it. It also, when CBD and THC are used together, we do tend to get magnified pain relief. It is not required to activate it, but sometimes if you are going to do them both together and you have them in a separate medicine, I always recommend to do the CBD product first and then follow it up with the THC. And I think that's where people get the idea that it's activated. But really what's happening when you do it that way is you get CBD peppering the cannabinoid receptors, and when THC then comes on board, it behaves differently. This can be, I think we do in some of our advanced courses at Medical Marijuana 411, we go through this extensively, but it is a misperception in terms of how it is phrased linguistically, but I do sometimes think it can be a positive thing to use the THC after the CBD, and that's kind of where people get this idea that it's being activated. What you're actually activating is the endocannabinoid system with the CBD, and once it is activated with that, it behaves differently when the THC then is brought on board. It's a pretty technical answer. Your bud tenders are not steering you wrong, but they are utilizing terminology that could be improved. And again, it's fairly abstract unless you have a base of education to view how these things are talked about.
Thank you. This is a great question from Tammy. Since we all have an endocannabinoid system, is there a need to supplement our bodies in order to stay healthy?
Oh, excellent question. In a perfect world, no, because in a perfect world, our stress is limited, we're always getting a good diet, and I don't have time to cook today, but somebody just delivered me a beautiful, fresh, or organic, healthy meal that I didn't have to cook. Well, of course, that's a perfect world. Cannabinoids are helpful for imperfect worlds. We can stimulate the endocannabinoid system through non-cannabinoid means. Good healthy fats, omega-3 fatty acids, will tonify and increase the activity of the ECS, the communication system. Exercise has been shown time and time again to enhance this system. We know that things like chiropractic manipulation show influence on this system that are positive. Acupuncture shows influence on this system and that it's positive. Even things that you do that make you feel really good, like singing in your car. There's actually a study on women, not men, where the women sang and they measured their endocannabinoid levels, which were upregulated. Now, would this happen in men too? I would imagine, but we don't have the studies. So hugs, things that typically make us feel good, tend to enhance communication with this system. So in a perfect world, it's already working great. In an imperfect world, which we live in, we sometimes need support. And I am very convinced that the nutritional piece, along with the cannabinoid piece, is essential. So I find that giving cannabinoids with omega-3s, I think the nutrition that comes from good, healthy fats are essential. So again, omega-3s, cold water fish, salmon, halibut, omega-3 eggs. You can do supplements, krill oil supplements. There are lots of ways that it can be supplemented and enhanced. And then things that we typically think of as good for us, such as taking a walk, getting some exercise, acupuncture, massage, chiropractic. These things also can tonify the system. And what they are really doing physiologically is helping us to adapt to a changing world and a changing environment. So I think especially for a senior population, adaptation is a challenge. I would not ever exclusively focus on just cannabinoids, but also the diet and the lifestyle, which also we know help support this system.
All right, good talk. Anybody else have any questions? That's the end of the list as far as I saw it on the group chat. But if there are others of you out there that want to unmute yourselves quickly and ask Dr. Jake and Medical Marijuana 411 a question, feel free to stay on, because I think this is a topic that many of you are interested in. So any other questions out there? Feel free to type it in the chat or online.
Or yeah, and feel free to unmute if that works for you. And I would just like to say that as we move forward and the science progresses, this is going to become a much more important system. And it really is about communication on multiple levels. It's about cell-to-cell communication. It is about organ-to-organ communication. And I think also even on a collective level, things like PTSD, which is when somebody experiences a horrific event and the nervous system cannot let it go. that's a type of maladaptation. It's a type of adaptation that doesn't really work. The cannabinoids can be effective on that level as well. So I think the more I study this plant, the more I see that the system that it works on is really very fertile ground for a lot of continuing health benefits, especially at the level of helping with seniors in the senior community. So,
Dr. Jake, can the use of cannabis increase anxiety and paranoia?
absolutely, it can. Specifically in and around THC, that is very common. There's two ways to mitigate that. One is don't take so much, please. I mentioned if there's only one thing I wanted you to learn, well, I forgot to say that. Don't use too much THC if it's either for yourself or with a patient. We can also mitigate that, that paranoia or that feeling of ickiness that people get, some people get when they have too much THC, by adding CBD in along with. So yes, indeed, it is probably one of the biggest problems, but it, in the world of problems, is not life-threatening. It goes away when the cannabis goes away. The problem is if you've done a high-dose edible, that might be 12 hours later. So you don't want to have that happen to you or anyone you know. And it's just the worst thing that can happen, because then the patient is not going to want to use this method that they can really help themselves with. So yes, good question.
All right, and I know that Chris, the founder of Medical Marijuana 411, she put in the chat box as well a good introductory course, Cannabis 101. So if you'd like more information on that to learn more and you didn't have your questions addressed, go check that post out in the group chat. There's a question from Barb. Can you discuss the increased fall risk in seniors if CBD THC edibles are used for anxiety? Is it different than prescription drugs might be?
Similar to certain medications like blood pressure medications, there's a couple of ways that folks are at risk of falls. It is one of the big concerns. One is that cannabis is a mild muscle relaxant, which means it's generally thought of as good for blood pressure. But with seniors, it can make the blood pressure too low so that when they stand up quickly, especially when they're first trying it, they can get a little bit dizzy. And that can cause a fall. And falls can be devastating, as you all know. So that is frequently occurs early on or with changes in medication, as is similar. The other area that is maybe a little bit dissimilar is that because it is a mild muscle relaxant, it does change reflex times. So I would be concerned about a patient tripping and not being able to recover because they're a little bit altered. And again, this is with THC. This piece is with THC much more so than it is with CBD. Sometimes CBD will affect the blood pressure, so that you want to have them be cautious. But again, it just emphasizes that seniors, for their health benefits, do not need a whole lot of THC on board. Because it's very useful in low doses, but as the dose increases, it becomes useful for fewer and fewer things. Things where high THC may be appropriate is with PTSD. High THC can sometimes be appropriate in seizures, things with central pain syndrome, and in getting folks to sleep well. But if you are going to be up and about, THC in any type of a high dose clinically, I think the higher you go with the dose, the more narrow your therapeutic window is. And it was a pleasure. Thanks again for having us. We really appreciate it.